Hey, Dr. Tako, how are you?
I'm doing good. How about you, Miriam?
Good, good. So today I'm going to introduce you. So you are um, a chiropractor. You've been in chiropractic for about 20 years. You're also specialized in sports chiropractic. You're also have a degree in regenerative nutrition. Okay, and then you incorporate all that as part of your practice. And I really would love to talk today about um, what we've been doing together to really help women and help them restore their quality of life.
Okay,
Yeah.
that's a worthy subject. So, okay, over the years of working with many patients, I realize how much the pelvic floor is contributing to dysfunction, whether it's spinal issues, digestion, hormonal issues, and various other issues that came as results of the treatment that we're doing here in the office. And it always kind of many times it tracks into the pelvic floor. So we started to treat pelvic floor, and over the years, I developed an approach that gets us really one, we understand in details what's going on there, and two, we get really fast and lasting results. So maybe you can share a couple of our cases that you've been witnessing and documenting, and maybe I should introduce you. So Miriam is the delivery room nurse, still active in the hospitals, delivering babies every day. And now she's collaborating with me, developing the whole system for pelvic floor health to resolve a lot of the issues that can come from pelvic floor issues. So if
Yeah,
you can, if you can share a couple stories.
yeah.
We have many, but couples. Okay.
Yeah, we do have many success stories. So, one of our patient, she was 45 years old at the time you started seeing her, and she had pain in her lower um, buttocks muscle, and she couldn't for over 5 years, and she couldn't sleep on one side, and that's really horrible when you're trying to sleep and you want to turn and you cannot, and it wakes you up because you're it's painful. She was not able to sleep on her side, and then she was not able to contract her pelvic floor. And the pelvic floor is, a lot of it's what we contract when like we don't want to pee or let out some gas, and she was not able to do that. Another way that it's called is like when people tell you, "Hey, do a Kegel," like that's contracting the pelvic floor, and she couldn't do that. And for over 5 years, she was trying to get the root cause of her problem diagnosed. And then she also, very important to note, that she had seen many providers, many doctors to try and resolve her issues. She also had, I think, two deliveries to birth, gave birth to two babies, and she had perineal lacerations. So she tore her perineum during the delivery. Of course, that got sutured,
Mhm.
and then again back to she was not able to do a Kegel, so to contract that pelvic floor. And after just 2 sessions with you, she was able to. And she also, over the course of the treatment, which was 5 weeks, and she got one treatment every week, she was then able to start sleeping on the side. So for her, it was huge improvement in her quality of life. So how do you explain that? Like, how do you explain
So,
results that she saw? Like, you know, because she had seen many physical therapists for months and months and months, and she was just not getting any results.
so I would say that traditional chiropractic didn't work. Adjustments didn't work. She already been through all of it. So I knew I have to take a different approach. And the approach that we take here is different than the traditional, I would say, physical therapy. Is in physical therapy, they take the approach of muscular. It's a muscular approach. So if you can do Kegel, exercise that muscles. And if you have a tight muscles, maybe we're going to stretch it. Maybe we're going to do some muscle work, manual work therapy. And if you have a weak muscle, we're going to exercise. We're going to try to do by repetition, we're going to increase the strength of the muscle. In my office, in my work, I take a different approach. I take the approach where the approach basically is that if a muscle is weak or a muscle is tight, there must be a neurological reason for it. And what we're seeing that when we approach it that way, muscle can change instantaneously. That's why it happens so quick. It happens in a visit or two or three or four, and we're able to do and make those kind of changes, lasting changes. This approach is a neurological approach. It was developed by a spinal surgeon from Mexico, Dr. Jose Palomar Laver. And with this approach, we are able to diagnose correctly, effectively, and create a treatment plan that doesn't requires many treatments because it's very specific. We're doing receptor therapy. Basically, it's a receptor therapy. So we're changing the receptor, the signaling that comes from the different injuries. And fundamentally, we're seeing two different categories of pelvic floor issues. Pelvic floor issues that are coming and stemming from the pelvic floor itself, meaning the injury could be delivery with episiotomy or delivery with lacerations when there is a natural tearing of the tissue and then stitches, or it could be sports injury to the pelvic floor. It could be from bicycle, from gymnastics. I see it a lot with gymnasts working with a bar and always hitting the pubic symphysis or the pelvic floor area. And over the many years of training, it creates a lot of trauma in that area. And as results of the trauma, whether it's a tear or stitches, what we see is that there are receptors that are misfunctioning, not functioning properly, and as results of that, muscle become tight or weak. So when we're approaching it that way, we can making a very quick change. And somebody who could not do a Kegel and trying because that's the instruction, do a Kegel. So week after week after week, months goes by and they can't do it. And then eventually they get frustrated. With our approach, within the first 1, 2, 3 sessions, they can actually perform the Kegel exercise. And this is just an example.
And so what I really like, and that I find fascinating with that approach is that, when somebody tells you, hey, doctor, I have a pain here, you are not actually looking at that area. You're looking at any area of the body that can be creating that pain.
True. So, many times that's the case.
Right. That's a very different approach, very novel approach that I had never seen before. And I had many treatments, modalities done on my body, and I had never seen that. And really, on top of that, thanks through that, you're really finding the root cause, and you're really able to solve the problem.
Right. And, and what you're saying that treating something else is the other category of patients. So we see patients that comes in with spasm in the pelvic floor. So they have painful intercourse, they have other issues, and then it's not very pleasant to live like that. And then the reason for it is not the pelvic floor. The injury is somewhere else. So we had a case where the injury was in the foot, and the patient had a foot surgery, and then that created signals that eventually goes to the brain, and the brain compensate, happened to be in the pelvic floor. Mm-hmm. And by the way, in other places too, but the pelvic floor is where the symptoms are affecting the quality of life in a sense. And those particular patient goes to the physical therapy, and sure enough, they're going to find that there is spasm in the pelvic floor, and they will try to release the pelvic floor. So the focus is always on the muscle in the pelvic floor. In those particular cases, I don't even touch the pelvic floor because it's not where I need to be. In these cases, I'm going to work on the area that causing the root signal that actually creating the compensation pattern in the pelvic floor. So in the case of a foot, I'm going to adjust and use various modalities in order to reduce the signal in the foot. Another case that I had with spasm in the pelvic floor, just as an example, was oral surgery. So we had to work in the mouth and around the jaws, and that released the pelvic floor completely. So we see those synergist kind of effect of different parts of the body on the pelvic floor. And even so, that's how we kind of resolving. So these are the two categories. Either the pelvic floor has an injury to it, like a delivery, that ending up in a episiotomy or tearing, or it could be completely from a different area. Two different scenarios. So in both cases, I think the key is to properly diagnose what's going on there, and not just to jump into conclusion. Oh, there is a tight muscle. Let's work on the muscle. Really understanding what's there, and from there, you can make the changes relatively quick. The other technology that we're using in the office in order to stabilize everything is shockwave. And shockwave therapy is a very, very effective. We're getting extraordinary results in the pelvic floor when we're using the shockwave in combination to the receptor therapy. And the shockwave could be utilized when the injury is somewhere else. If I need to stabilize a foot or an ankle or whatever it is that I need to do, and we can use the shockwave synergistically there to create lasting results.
Right. And the way we use that, it's a little bit like an ultrasound machine. Like it has a wand, it's connecting to the machine, and then we put gel right on the area that is to be treated. So often it is the pelvic floor. Sometimes it's a C-section scar.
Right.
And I apply the wand and I treat the area. And what that does is that it helps trigger the healing cascade. So cells get activated. There's less inflammation. There's more blood flow to the area. The pain is decreased, and the healing again just continue or finishes from whatever trauma, whether it was that perineal tear or that C-section scar,
Right.
or that direct trauma from like a bike accident on like the ligaments, for instance, and that area is able to fully heal.
Right.
So the combination is really amazing, gives really amazing results.
Absolutely. And I'm very happy that you're witnessing all of it and documenting all the cases, because we have many cases. And so I would like to put a call for action to the public who is listening to this. And if you are suffering from those issues in the pelvic floor, your quality of life is low, you already treated this with a pelvic floor specialist and it failed, we are getting really great results. And with these kind of cases, and because the approach is different, and I would invite any of you to just pick up the phone and call the office and make the appointment. Don't be shy about it. It will change your life.
And that's why I work with you in the office and I work in the hospital, and for me it's like it comes full circle where I see unfortunately the damage happening. I see women tearing, in front of my eyes as they're bringing life in front of into the world. But then in your office, I get a chance to help them repair and get their bodies back, and so they can really enjoy their quality of life. Leaking urine when you sneeze and cough, it's not normal. It's not normal, and nobody should have to live with that. We have patients.
And many are, many.
Oh, yeah, and we don't talk about it.
No, it's taboo. Nobody talks about it. It's
Well,
embarrassing.
I think once it's taboo, and the other thing is that many doctors or many health practitioners just don't have an answer. They don't have a solution. So, why ask a patient, do you have this symptom? Well, okay, yes, I have it, doctor, but okay, then I'm sorry, I cannot help you with that, right? When we have a solution, and it's amazing to see. I mean, it was like a 72-year-old woman who had urinary incontinence, and whenever she would drink, she needed to run to the bathroom. So for her, like, she would not leave her house. She would just, really limit her time outside of her house. And after just one treatment, she's like, "Oh my God, I was able to go on a hike and, have a normal day." It's huge. I mean, another thing that we don't talk about is, vaginal spasms that create pain during intercourse. I mean, that's part of life, right? You want to have a sexual life with your partner, your spouse, and you cannot, and that's not fun.
It's not fun, and that's affect the relationship overall.
It affects people's self-confidence. Obviously, having pain, it's you know, whenever, that happens, that's not good to endure, and then impacts the relationship. So it has big consequences, and I think we underestimate, the that all those trauma, all those surgery, the tearing during birth that happen, the the effect that can have down the road, and the effect that all that can have on women's life. And I'm really grateful that I'm able to help you uh, restore their quality of life back, really.
And thank you for that. Okay. So thank you, Myriam. And hopefully
We'll talk again soon.
we'll talk again soon. Thank you. Have a good day. Bye-bye.